Welcome, feathered friends and bird nerds, to Raptor Radio, the podcast soaring high above the rest. Get ready to sink your talons into all things American Eagle Foundation and all things Raptor. From majestic eagles to charismatic corvids, we'll be providing you with updates from our roost while educating about the wide, wild world of raptors. The sky's the limit for our host's passion for magnificent birds of prey. Leading us in this endeavor are your hosts, Dr. Robin Miller and Crystal Slusher.
So let's get physical. We've talked about our annual physical exams with these birds a few times, and I'm keen on diving a little bit more deeply into that topic. So what exactly does an annual physical exam for a bird of prey look like?
An annual physical exam is just like you going to your physician to help either identify how you're doing or identify if something's not quite going well. And we do blood work and we do the physical exam and we send the blood work off, like Nancy said, to University of Miami. And they are phenomenal at getting results back very quickly so that we can assess that work, the blood work, and then decide what we want to do from there. But it's all about identifying whether or not there are health issues we need to address. Because these birds are in managed care, some of them have eye injuries, some of them have physical injuries, wing injuries, and things like that, so they can't be released back out into the wild. And those are chronic situations that are not going to change.
What does chronic mean?
Long-standing, something that's been going on for a while. And that can be weeks or in some cases years and years for some of our ambassadors. So what we want to do is just make sure that those chronic injuries are not progressing. We want to make sure there are no new issues that have come up, and if they do come up, we can address them quickly rather than waiting for them to smolder along for a long time, and then when they get really bad, it's harder to treat them sometimes. The physical exam, we look at the birds from the tip of the beak to the tip of the tail, and we want to make sure that everything is as it should be. The eyes look good, the beak looks good, the mouth looks good, and so on, all the way down to the tip of the tail. So that's what those exams usually involve.
And I will say one thing that's also very important, it's a very stressful day for the bird. So it's really important to have absolutely everything that's needed at hand so that, and then like I said, we worked as a team for a while and we knew what to anticipate. So like a typical day of physicals, we'll know that we'll do either 14 to 20 birds that day. So we basically will have someone cast the bird and then we work as quickly as possible. We'll usually get blood work first because as the bird's stress, that can alter lab results. And then as soon as that's done, Dr. Jones will do a head exam, an opto exam, and then we can cover the heads to help them calm down. It works kind of like blinders on a horse. All the birds settle down, once they have their head covered. And then also we're fortunate enough to have 2 veterinary schools in the area, so we generally will have veterinary students with us that will learn, assist, and get to pull blood on a bird sometimes for the first time. And it makes it a wonderful, positive day.
Can you tell us what casting is?
Yeah, casting is restraining the bird, and generally we'll use wear gloves, use a towel, cover the bird's head with the towel, and then particularly the wild birds, that's generally how it's done. Some of the trained birds, it's not really going into their enclosure and covering them. It's more of like wrapping a towel around them. But in order to be able to pull blood, you need to make sure that the feet are secure and the head is secure.
So it's a means of safely restraining the bird so that they're as calm as possible, and both the bird and the human holding them are also safe.
Yeah, and the wings are in normal position because it's easy, fractures can occur if they're flailing and they're not restrained properly. So
Casting is one of my favorite terms. Dr. Jones, you know where I'm going with
Yeah,
this
I do,
because
I
there's
do.
so many different ways that it's used within bird jargon, because they can also cast and produce a pellet.
Yeah.
Of,
That's how our online community would probably understand casting because of following our live bald eagle's nest.
yeah,
So
they're used to the pellets
They are.
of non-digestible fur and bones that birds of prey and corvids produce on a daily basis. Any other definitions of cast that you enjoy? I'm just picking on you now because you're a
Yeah.
falconer.
No, those are the two main ones. Is what that casting, what they bring back, or is the proper term is called egesting, rather than ingest, but you egest.
yes.
What you can't.
Yeah, and then casting or restraining the bird, or sometimes casting it off, letting the bird, if you're in a falconry situation, letting the bird leave your glove, can be casting the bird off as well.
You
I've
can
heard
also
that term before in the past. The one that you just mentioned.
Yeah.
You can also fly a cast.
Yes.
So a certain species will fly in a group like harrises, and that's also called a cast. So it's one of those multifunctional, fun bird nerd vocabulary terms.
Right.
So besides securing their feet and the business ends of the birds and covering their heads so that they're not visually stimulated, is there anything else that you guys do to keep the physical exam stress-free?
I think one of the things that we do to keep it as stress-free as possible, because it's going to be stressful no matter what, because we haven't handled these birds, some of them, for nearly the entire year, especially Eagle Mountain sanctuary birds. But making the exam very efficient and quick, so that it shouldn't take half an hour to do a physical exam, but we try to pare that down. So we get them in, the caretakers bring them in, we do the blood work, we check the head, make sure eyes, ears, nose, mouth, feathers on the head are good, and then we place the hood, like we talked about earlier, and then we try to get through the rest of the exam quickly and get them back out either into their normal enclosure or another temporary enclosure. So I think the timing of it is what helps to make it stress-free as well.
And also with our ambassador birds, generally their caregivers are not anywhere in the room when that bird is being restrained. And then once the physical exam's done, their caregiver comes back in and will take the bird and give them they'll go on the glove, get a snack, and have a chance to relax a little bit after their doctor's appointment.
So the avian care specialists are almost like poised to be like the hero in the situation.
They rescue.
Yeah.
Yeah.
Yeah, so they're pretty much, we want to keep that bond still with them the whole entire time, because again, we're almost like the bad guys here, but we're doing everything as possible to give them the proper health care that they need. So to try to keep it as stressful as possible, and that's the best thing for us to do for them.
So why does a hood work on birds of prey, but not our dogs or cats or lizards when we take them into the vet?
I think maybe the behavior. I think with dogs and cats, because they are a domesticated species, they are more familiar with being around people. You hear stories how cats hate to go into the hospital, so they probably know when things that morning are beginning to change and their normal routine changes a little bit. They're like, okay, what's going on? And then that's when the cat goes and hides, and then you spend half an hour trying to find it. But I think the domesticated animals probably have a little different relationship, because if I was doing dogs and cats, I could get the dog out and pet it and who's a good boy and all that. Can't really do that with our birds of prey. So I think there's probably a different dynamic. Although, going back to some of the falconry literature and associated kind of sports, cheetahs would wear hoods when people use cheetahs to hunt gazelle and antelope. They actually have hoods for them. So I think it just helps to redirect the behavior of the animal so that it's not focused on what's immediately in front of it. The hoods completely cover the head, but there's an opening for the nose and the mouth, the beak to stick out so they can breathe just fine. but not being able to see what's going on, I think, has a calming effect versus if we didn't cover them and they, here's people coming at them and going away and hands coming to them and all these things that are associated with an uncomfortable event for them. The hood helps to kind of take that away.
So I guess it's like kind of peeking through your fingers if you're watching a scary movie.
It could be a scary movie for them. We try not to make it a scary movie, but it is uncomfortable, not in a painful way, but just, this is something that they're not used to. Because the interaction is totally different. When they're on the glove with their avian care specialist, there's a different interaction versus now we're casting them and we're holding them. And then, I'm sure in their eyes, they see somebody coming toward them, it's like, whoa, like this. That's not what we want, but if I can anthropomorphize, that's probably what they see.
Yeah.
And birds are such visual animals anyway. They process information through their eyes at a scale that we can't even begin to comprehend. So I can see why cutting off that particular sense would be helpful in keeping them calm.
Right. And they detect our movements so quickly. Even small movements, they can detect those. Whereas other species may not pay attention to those movements. Birds of prey, their eyesight and their ability to process that, like you're saying, they can pick up movements far faster than most other species can.
I heard it postulated once that they could actually see each flap of a hummingbird's wings.
I love bird eyes, eagle eyes and raptor eyes, other raptors. The flicker fusion frequency and the ability to detect, let's say, flashes of light. So when we look at a fluorescent bulb, like one of the long ones, to us it's a constant light. To some species, birds in particular, it probably looks more like a strobe light. So that's where a lot of facilities have gone to looking at welfare of birds that are in managed care and replacing those with different lights that don't have that kind of flicker or fusion. So for those watching, next time you look at a fluorescent bulb and you don't see the flickering, that's because you don't have a high enough flicker fusion frequency. Whereas they can pick up the wings of the hummingbird, and I picture merlins who catch dragonflies in the air can see the flapping of the wings of the dragonfly, and when they make sudden shifts to change motion. I'm getting on the side.
This is great.
But I love raptor eyes are incredible, and I could talk about them all day. And they're predators, and what their eyes are, and their body in conjunction with, chasing prey and how they keep their head still. And there's different reflexes that they use to keep their head still when their body's rotating side to side, and they're dodging limbs while they're still trying to catch up with something that's fleeing from them. We'll be here all day. I'm sorry.
No,
We'll be here all day.
this is definitely future episode content. So
Yes.
if you're into this will occur at a greater length in the future. I also love raptor eyes.
Oh, yeah.
I'm so glad you brought up flicker fusion frequency. I always liken it to like frames per second. If you're into TVs or video games, you know what I'm talking about. It's the same concept. And speaking of eyes, we do have an aging fleet. So I guess my next question would be, during the exam, are there things that you pay closer attention to with our educational ambassadors that you may not necessarily keep an eye out for as much with rehabilitation triage?
That's a great question. Because we have older birds in our fleet, you wouldn't see these out in the wild, because if they develop certain conditions, they wouldn't survive. But we do see cataracts in some of our birds. And they usually start out as what we call incipient cataracts, so like this little tiny spot in the center of the lens, and then it progresses from there. And we have birds with a number of birds with significant cataracts that we have to keep track of and make sure that they're well taken care of. They can still see, but the degree of what they can see through or around the cataract in the lens, probably varies. So that's probably one of the most common problems that we see with birds that are aging, that are 25. We have 25-year-old 30. We have a 44, 45-year-old, golden eagle. So age is not a disease, but there are things that come along with age, and cataracts is probably one of the most common things that we see that changes dramatically in our aging group of birds.
Well, I mean, the thing is that even though we look at all the birds through their annual exam, we check and make sure from their past of injuries that they've had before. So like, again, for the cataract aspect, like sometimes that'll come up due to age. We'll look and see like for arthritis on a lot of the birds as well if something starts occurring. So we try to look at their past records and a lot of them to see what has progressed due to how old the bird gets and see if we need to do something different through medical reasons or anything.
Another problem in our aging fleet is that now that they're getting up in age, just like with people, they're developing some arthritic joints, and birds exhibit symptoms of pain differently than other species, and most birds, if they are limping or their gait has changed, they must be really hurting because their instinct is to appear normal. That's their survival skill, to not look fluffed and ruffled. So if they get to the point where they're fluffed and ruffled and walking, they need some attention. So luckily, as we've said before, avian staff really know their birds, so we catch things early on. But if we want to rule out arthritis, they would go in for a full exam and have the joints x-rayed that are in question. Because, even though they get wonderful care, we're not with them 24 hours a day. So we got to rule out immediate trauma, or is it just an old trauma that has become inflamed?
What is your favorite or least favorite bird to examine?
I mean, pretty much I like all the birds, to be honest. So it's really hard to find a least favorite thing about them.
No, I like all of them. I don't have a least favorite. I'm being honest. My favorite raptor is the golden eagle. And so any chance I get to work with one or two of our golden eagles here, then I'm ecstatic. I love all birds of prey, but the golden eagles have just grabbed my attention from when I was a little boy. But I like them all. There's no least favorites.
Is there any one of them that's particularly challenging?
There's some that are trickier than others. Poe always bites me. And even though I try to take precautions, like, not this time, Poe, you're not gonna bite me this time. And they're so smart and he's so intelligent. And I think when I'm working and examining his eyes and ears and I'm holding his beak so he can't bite me, he must sense like that little moment where I relax, or Poe just is very relaxed during the exam and just kind of sits there like this. And so maybe I relax, and the next thing I know, wham, he's got me. And it's not a big bite, it's just like a little nip. But every year for the past like 4 or 5 years, I'm like, Poe is not gonna get me this year. And then he gets me. So, but I love Poe.
If I have to with a bird, that would say is probably least favorite to try to capture, to have to get a physical exam, is Saphira. Saphira is one of our largest eagle that we have here, and she is very smart when she knows, whenever we have our gloves on and a towel in our hands, she knows where to be at a spot and hang there, and it's hard for us to get her, and sometimes it can take us over 30 minutes, even up to an hour if it might have to, but we try not to get to that point.
I know it sounds like a broken record, but I love them all too. Now I will have to say, we usually do physical exams on the vultures last thing, because sometimes even if they're fasted before the exam, they may deposit some vomit on the floor. It is their normal defense, and we appreciate it about them, but it can clear out a room.
Years ago in working with parrots, people would assess the intelligence of African gray parrots, and I think most raptors, and especially the corvids, equal, I think sometimes, if maybe not even surpass the intelligence of African gray parrots, because they're just phenomenal. What I think we would say is that you would tell the parrot what you're going to do. We're going to do a physical exam today, and these are the things that we're going to do. And I don't know if we should try that with some of our corvids and our vultures, but they're so intelligent, and I think it might be something to try. Can I get a shout out to Barbara Heidenreich?
Absolutely.
Yeah, Barbara years ago gave a presentation on working with a harpy eagle and getting blood samples and doing a physical exam on a harpy eagle that's sitting, I think it was on a perch, and the training that's necessary. And I would love to get to that point with all of our birds. Mm-hmm. Again, we only see them for that snippet. If we were working with them like day in and day out, there would probably be an easier way to get to that point. But yeah, these birds are so intelligent, and there's so many things that we could explore on how to make. We talked about making things less stressful, how to reduce the stress for our avian ambassadors.
You mentioned earlier that you have vet students accompany you on these annual exams. What sort of opportunities are they getting from participating in our care of these birds?
I think a number of vet schools have programs that work with exotic or zoological species, avian and exotic pets, but not everyone does. I was fortunate that at the University of Tennessee we had a very strong avian and zoological medicine department, so the students got to work with a lot of different species, from pet birds to rodents, rabbits, reptiles, zoological species as well, but some schools don't. So we are happy to augment the education of veterinary students. So most recently, we've had the opportunity to work with 3 Lincoln Memorial University College of Veterinary Medicine students that did a fantastic job. But I think in the long run, and both Nancy and I kind of came out of the University of Tennessee as an academic institution. I stayed at the University of Tennessee for 30 years, not because that was the only place that I could do exotic animal medicine or avian medicine, but I love teaching the students. And so I wanted to transfer that here and give students the opportunity to come here. Once our hospital is up and running and we are in full operational mode, we expect to have externships for veterinary students, not only from the region, all across the nation, international students. We've had some interest from a lot of people that want to come. And so there's going to be a great opportunity for us to really contribute to the education of veterinary students, specifically in Raptor medicine and surgery. And in my vision, it's going to be a fully immersive. They aren't just going to learn the surgical and medical care, but they're going to learn about training and diet and husbandry and all the things that our avian care specialists do, so that when they come here, they get that they get that education. When they leave, they should be able to step into any zoological park or any institution or wherever they go and be fully versed in raptor medicine, raptor biomedicine, ecology, biology, and just, hit the ground running. That's my dream. That's my goal.
That's an amazing dream and goal. And I think that your passion for teaching kind of goes both ways, because whenever we do live streams with you, whenever you appear on our social media, some of your students show up in the comments.
Yeah, there was one yesterday. I was glad to hear that.
One of your former students actually takes care of my dog. So
One of your former students actually takes care of my dog as well.
Awesome. That's what it's all about for me. It was my veterinary career, certainly was great to do what I do, but a large portion of that was educating other veterinary students and bringing people into the profession that may not normally have been exposed to that. So underrepresented minority students and exposing students of all races and ethnicities this incredible career as a veterinarian or a veterinary technician. There's so many different career opportunities for that, but I love the teaching aspect almost as much as I love the actual physical working with the birds.
And I have to plug this because I will be working with the 3 of you on this initiative, but here at our new facility, we're going to be offering something called a junior Raptor vet program for ages 3rd grade through high school, hopefully, that allows students to step into the role of Raptor vet and kind of simulate a raptor rescue, and then triage or examination, identify what's wrong with their patient, and then determine whether or not that patient is appropriate for release or should remain with humans as an educational ambassador. So stay tuned for that educational opportunity.
I'm so excited. It's going to be awesome.
How will the future rehabilitation center change or impact how physical exams are done?
That's a great question. For the physical exams, right now we're doing them in like specific locations, whether it's in the Dollywood theme park at our Wings of America show, kind of backstage, or in one of the vestibules of one of the wings is where we call one of the areas that they stay. So with a new hospital, we'll have a dedicated area. So everything we need that will be right there. We won't have to transport it anywhere. The birds will be able to come to us and get the care that we want to provide for them. We provide great care when we're out and about, but here having the opportunity to have everything with us that we need and in one discrete location, I think is going to be great. It's going to be easier, probably reduce the stress for the birds as well. And then the hospital in general, we have a sense of community. I think for us being here in Kodak is not just to be American Eagle Foundation and Kodak, but I think we serve the community. We talk with kids in schools and things like that, but we're also going to be a resource for not only the local community to bring birds to us, because sometimes it's difficult to get them to other places, University of Tennessee or other places. So we're going to be that resource for people to bring birds to us. We get a lot of calls from Tennessee Wildlife Resources Agency and sometimes U.S. Fish and Wildlife and the Smoky Mountain National Park Service that are looking for places to take injured birds of prey, and we're going to be that resource for them.
We will be able to do all diagnostics. We'll have our own X-ray machine, so if we'll be able to reduce stress in the fact that we'll be one stop.
So how can our listeners support this future Raptor hospital?
I mean, the main thing is that we definitely we're showing ourselves a lot for the rehab team on social media. So, I mean, really supporting on our social media platform on TikTok and Facebook. But our main thing is definitely donations, because we really want to get that hospital up and running for us. So doing as much as possible, because all this goes back to our birds, but also for the hospital in general.
We are a nonprofit organization, so all donations are charitable, go back to the care of our birds, and also back to the community through our support of continued education for vet students.
Right.
That's all the time that we have for today. So as our guests, I would like each of you to sign off with a brief reminder of who you are and a quick favorite bird fact.
Oh,
It's not going to be quick.
Okay, so I'm Dr. Michael Jones, Director of Rehabilitation and Research, and I want to thank you for taking the time to listen to what we had to say today and express kind of our interest and our love for what we do and serving not only the birds of prey but also the community. And we really appreciate you and everything that you can do to help support us. An interesting bird fact would be, again, going back to the eyes, there's research, there's still a lot that needs to be done, but there's research that suggests that birds of prey, at least some of them, can see in the ultraviolet spectrum.
There you go, Nancy. Okay, this is Nancy Zagaya signing off with a myth buster. You can put baby birds back in the nest, even if you've touched them, whether it's a bird of prey or a songbird. If it's uninjured, put it back in the nest. Spring's almost here.
Okay, this is Brad Skinner, Rehab Associate, signing off here on Raptor Radio. My favorite bird fact I had to say is Raptor Pressure. So a lot of people don't know that eagles have the per square inch of pressure. They can get about 800 pounds to almost close to almost, I guess I should say roughly around 500 to 800 pounds per square inch in their talons. So I think it's the most fascinating thing ever. It's the reason why we wear gloves is because due to their pressure that they can have on them. Because even though you might see a bird that could be like small enough that you think, oh, you can easily get it, you want to make sure to have proper equipment for gloves, towels. So that's why I think it's just fascinating how much pressure they can put through their talons and feet.
This is Dr. Robert Miller signing off, and my favorite bird fact has got to be that bearded vultures will intentionally dye their feathers red.
Oh, and the hair flip.
This is Crystal Slusher signing off. And I think one of my most favorite bird facts is that most birds are monogamous. Most, not all.
Hey.